Hello, you're watching Eye on Africa with me, Yenali. Tonight, countries across the continent are speeding up their coronavirus prevention plans. This as authorities fear weak health infrastructures could leave the region particularly vulnerable to COVID-19. Also in the show, we take a closer look at how the Democratic Republic of Congo is getting ready. Public gatherings are banned there, but enforcement remains a challenge, especially in the mega-city capital of Kinshasa. And the Afro-jazz legend Manu Dibango has died at the age of 86. The Cameroonian star passed away in a Parisian hospital after contracting COVID-19. $150 billion in emergency aid and debt relief for Africa's poorest countries. These are just some suggestions that Ethiopia's government put forward to the G20 to help fight COVID-19. 43 out of the 54 states on the continent have confirmed cases of the coronavirus. Africa CDC says more than 2,000 people have been tested positive. Most states have suspended flights, closed schools, and banned large gatherings to contain the virus. Many people are happy with these preventive measures, but some disagree with them. We take a look at reactions in two countries, Cameroon and Liberia.
In Cameroon, the government has closed its land, air and sea borders indefinitely. Schools and universities have been shut down to stem the spread of the coronavirus. Workers at this bus station are afraid the authorities might soon take more stringent measures.
If I know what for some days ago, they hamburg me. The sick way don't come for the way the doctor work no they go hamburg me plenty. Because I've got to get my daily bread for feed my house.
The country reported its first death due to the coronavirus on Tuesday. Bars and restaurants have to close at 6 p.m, but they remain very busy during the day.
Je trouve ça un peu logique parce qu'avec la maladie qui est dehors, on ne sait pas d'où est-ce que la maladie peut venir. Donc le gouvernement, en faisant ça, quand même, il essaie de protéger la population camerounaise.
In Liberia, the government has also closed schools and universities. Nearly 5,000 people died there during the Ebola epidemic that broke out in 2014. Some people have expressed doubts about the presence of the coronavirus here, but health workers are wary.
I believe that the sickness is here because when Ebola came at the city, who the Liberian people talking say is what.
For the moment, 3 cases have been reported in Liberia. At the start of the Ebola crisis, some had accused the government of Ellen Johnson Sirleaf of inventing it simply to get funding. At this market, many traders and customers said they were once again skeptical of the authorities. And very few people bought masks from street sellers.
Africa has so far been less affected than Asia or Europe, with proportionally far fewer cases to date. But in some ways, it has had a bit of a head start. Earlier, France 24 spoke to Judd Devemont. He's the director of the Africa program at the Centre for Strategic and International Studies. We asked him if some of these measures came perhaps a little bit too late.
What has happened in South Africa or other African countries is not unlike what's happened in the rest of the world. Until you start seeing the caseloads, until people start dying, governments have been reluctant to impose harsh restrictions because of the economic blows and because perhaps they feel like they're inured to it. But what I would say is that South Africa at this juncture is probably the most aggressive on its approach towards this disease, in part because of the number of infections and the 21-day shutdown. No other country in sub-Saharan Africa has done that. And what I think is particularly important about what Cyril Ramaphosa, the president, is doing, he is working across the political aisles to address this problem. In no other country have we seen such a unified political class to try to confront this problem head on. And I can say that's true even of my own country.
A day after Ivory Coast's President Alassane Ouattara announced a state of emergency, the country is ramping up prevention measures. The West African nation has over 24 confirmed cases so far. The latest details with France 24's Sam Bradpiece.
As part of the state of emergency here in Côte d'Ivoire, the government has unveiled a number of extraordinary measures. These include a curfew from 9 p.m. until 5 a.m, the shutting down of local restaurants known locally as maquis. These are important social hubs. And of course, the making available of 146 million euros or thereabouts to fight against the spread of coronavirus. People we spoke to here in Abidjan seemed broadly happy with the new measures.
En fait, je pense que cette décision prise par le président Alassane Ouattara est une décision très salutaire. vu qu'actuellement l'état d'urgence a été décrété dans tous les autres pays du monde, il faudra que la Côte d'Ivoire puisse se conformer à la réalité sociale.
Et vu les circonstances qui se passent, donc on est obligé de suivre ce qu'on nous dit. Chose qui n'est pas facile, c'est vrai, parce qu'on a quand même nos loyers, on a nos employés à gérer, on a nos familles à gérer.
De manière globale, nous apprécions beaucoup ces mesures parce qu'elles vont permettre à la population d'éviter énormément la contamination entre elles par rapport au Covid-19.
The new restrictions come into play just as Prime Minister Amadou Gon Coulibaly has himself gone into quarantine after having come into contact with an infected person. A presidential candidate in October's upcoming elections, he is, for now, not showing any signs of illness.
The Democratic Republic of Congo, too, is launching stricter measures to stop the spread of this virus. With 45 confirmed cases, including several deaths, the country is putting the emphasis on prevention. Our correspondents Juliette Dubois and Clément Bonnereau bring us this report from Kinshasa, where they spent a day with a medical surveillance team.
DR Congo's response to COVID-19 begins here in this office of the Health Ministry. Since the launch of a hotline a week ago, phone calls have been pouring in. On the other end of the line are concerned Congolese people with symptoms such as cough or fever.
Ce que nous faisons, c'est de prendre de ce numéro tous ces coordonnées. Nous, à notre tour, nous allons transmettre qui sont sur terrain afin qu'ils puissent rejoindre la personne qui est inquiète par rapport à sa santé. Ouais, c'est à tout moment que nous recevons les appels.
After a few more calls, Dr. Katende sets off with his team. Most cases he has to investigate are businessmen who've recently returned from Europe. There are also people who've been in contact with travellers. This doctor is one of them. Dr. Katende goes through a list of questions to determine the proper course of action.
Vous avez été en contact avec quelqu'un suspect ou probable ou confirmé de la maladie, du coronavirus? Un suspect, c'est celui qui a présenté les signes comme il est là. Il devient suspect. Il a été contact, il a présenté les signes, c'est ce qui fait qu'il devient suspect.
In Kinshasa, test samples from suspected cases are sent to the National Institute of Biomedical Research. If positive, patients are immediately isolated and taken care of in one of the city's hospitals. The others are asked to confine themselves, the aim being to stop the virus from spreading.
La plupart des cas, ce sont des cas qui viennent de l'Europe, ils ont des moyens. On peut demander à ce qu'ils puissent s'isoler. Mais si ça arrive au niveau de la communauté, nous savons comment les gens vivent. Des pièces, 15 personnes, 20 personnes, et lorsqu'il y a quelqu'un qui fait malade, donc la propagation pourrait être catastrophique. C'est pourquoi nous voulons anticiper, nous ne voulons pas arriver à cela.
Should the epidemic worsen, the DRC would be unable to cope with an influx of sick people. According to the National Doctors Union, there are only 50 respirators in the country.
Kenya has received a shipment of medical supplies from the Jack Ma Foundation. It includes 20,000 COVID-19 test kits and 100,000 face masks. The Chinese billionaire behind tech giant Alibaba has been sending equipment to countries around the world suffering from COVID-19 outbreaks. Hundreds of thousands of kits and gear arrived in Ethiopia on Monday. From there, the stock is being distributed throughout the continent.
It calls for not individual or separate actions. We as Africa, we Ethiopia and Kenya as good neighbors, we should bring all our resources in the fight against this global and regional problem. His Excellency Prime Minister of Ethiopia, Dr. Abiy Ahmed, has taken an initiative with Alibaba foundations to bring support to Africa.
Legendary musician Manu Dibango has died after contracting the coronavirus. The 86-year-old Cameroonian star was one of the pioneers of Afro-jazz, known for fusing funk, soul, Congolese rumba with traditional Cameroonian music and even French chanson. The veteran artist had become an ambassador for African music. France 24's culture editor Eve Jackson tells us more.
The 86-year-old died early this morning in a hospital close to Paris. The saxophonist is one of the first international stars to die as a result of the coronavirus. Manu Dibango is probably best known for his 1972 hit Soul Makossa, but also for his collaborations with the likes of Sting, Peter Gabriel and Youssou N'Dour. He was a pioneer of Afro-jazz and fused together funk with traditional Cameroonian music. He arrived here in France when he was just a teenager in 1949, and he continued to perform until the end. He was a guest here in the France 24 studios late last year to talk about his 60-year career. And internationally, he was also known for accusing Michael Jackson of stealing one of his hooks for his song Gotta Be Starting Something. They settled out of court. A small funeral will take place with very close family members, and it's hoped a larger gathering can be organised as a tribute to this legendary musician.
A true music icon indeed. Thank you for watching this edition of Eye on Africa. Don't go anywhere though. More international news coming up right here on France 24.